Now, for the pathophysiology, the next pathophysiology is pathophysiology related to reduced breastfeeding. We did not speak about that initially, but we have also pathophysiology related to reduced breastfeeding. Now, for the pathophysiology of birth asphyxia, prematurity, and low baby related to reduced breastfeeding, the first element is that you have generally, is it clear, the child is going to have hypoglycemia. Is it clear? Hypoglycemia is going to be involved in that. Now, the next the next element is that you are going to have electrolyte imbalance. So the hyponatremia, the hypokalemia, you're going to have hypomagnesemia, and you have hypocalcemia. Is it clear? Hypocalcemia. So generally, just you need to replenish this substances if the child is not eating for a long period of time, and particularly calcium is going to be replenished on the first day, while sodium and potassium are going to be replenished as from the third day, because by the third day you can already see a concealed acute kidney injury. It's very important to replenish them only by the third day and not from the first day like calcium. Now, since the child is not also eating, you're going to have a decrease in the weight. It's also another complication. You have a reduced weight of the child. It's another complication. And since so those are the different complications that the child, you have also food is going to reduce food of the child, is going to result to hypothermia. Is it clear? So those are the different elements associated with reduced breastfeeding. Also, reduced breastfeeding can result to stress ulcer. Since the child is not eating, it can have also stress ulcer from the reduced breastfeeding. Is it clear? So those are the different elements associated with the reduced breastfeeding. And lastly, reduced breastfeeding is going to, this reduced weight like that is going to be what is called undernutrition of the child or failure to thrive. So those are the different complications for birth asphyxia from reduced feeding. The reduced feeding is going to result to hypoglycemia, hyponatremia, hypokalemia, hypomagnesemia, hypocalcemia. It's going to result to undernutrition or failure to thrive. When there's undernutrition in the age less than 1 year, it's not called malnutrition, it's called failure to thrive. There can be hypothermia from this reduced breastfeeding, and there can be also stress ulcer from a local reduction of the perfusion of the feeding at the level of the stomach. Now, so those are the different elements. Now, other pathophysiologies like stress, is it clear? Other pathophysiology like stress may result to stress ulcers. Is it clear? So those are, and particularly those stress ulcers, you need to know that stress ulcers peculiarly are also called, so you have also stress ulcer, and depending on the stress, we have different types of ulcers. Is it clear? So you have different type of stress ulcers depending on the stress. Different type of stress ulcer depending on the stress. Now, you have a stress ulcer called a Cushing ulcer. Is it clear? Cushing ulcer. Now, you need to know that what Cushing ulcer is a stress ulcer which arises from an increase. The stress is big. Is the increase in intracranial pressure. Is it clear? This is the stress. So in Cushing ulcer, the stress is an increase in intracranial pressure. Is it clear? When you have a patient that has an increase in intracranial pressure having a stress ulcer, it is called a Cushing ulcer. Is it clear? Now, the next one is a curling ulcer. Is it clear? Curling ulcer. Curling ulcer is when the stress resulting to the ulcer is as from the stress resulting to the ulcer is as from the burns. Is it clear? So when you have burns in a patient, that results to stress, that results to ulcers. It is that results to, when you have burns that result to ulcers, the ulcers of the stomach, it is a curling ulcer. So those are different examples of ulcer you have, and all these enter among stress ulcers. You have iatrogenic ulcer from ibuprofen and all, and steroidal induced. You have anti-inflammatory induced ulcers. So those are the different ulcers depending on the stress mechanism. Now, after visualizing all these pathophysiologies, we need to now move on to the different elements.